from the Psych Hub Podcast Network.
Hi, I'm Marjorie Morrison.
And this is Patrick Kennedy.
And you are listening to the Psych Hub Podcast, The Future of Mental Health. Dan, we're so excited to have you on the show today. Just to kind of start, why don't you tell us a little bit about your background and how you got into running NAMI, where you started and how you got there?
Well, thank you, Marjorie. And first and foremost, thank you to Psych Hub and thank you to Patrick for this invitation on behalf of NAMI. In terms of me getting into this work, I started in private industry and spent about 32 years working in private industry. And in one of my last roles, I was actually doing public sector work, working with not-for-profits and working with the public sector from the standpoint of governors, Republican, Democratic mayors, city leaders, county leaders, and also with law enforcement and a number of other sectors inside of the public space. And that led to the opportunity for me after 32 years in the for-profit to give back. And it started out with me working at the National Association of Counties, doing all the programming there and working with about 3,069 counties across the U.S. and doing some justice work and some other health work and things like that, and then moved over to run the American Psychiatric Association Foundation, where we did programming for communities and outreach in terms of the faith-based community, the justice community, and we're very involved in the Stepping Up initiative, both at the National Association of Counties as well as at the APAF, working with the Council of State Governments and looking at the overcriminalization of the mentally ill in the justice system. And then had the wonderful opportunity to come over and work for and be in this role for NAMI.
That is amazing. I think we just need to stop for 1 second and just really kind of take that all in. NACo, I mean, you just sort of glossed over it, but when we think about how much work happens at the county level, that's amazing that you have that experience of really seeing what happens county to county. And then going over and just diving right in over American Psychiatric Association Foundation. I bet that was an amazing transition. And then going over to NAMI, how lucky NAMI is that they got someone with your background, because that's pretty unique.
Yeah, well, thank you. I mean, at the counties, was able to visit many of the jails. I made 3 trips to Cook County and interacted with Tom Dart, the sheriff there, and I went out to the Twin Towers, LA, and then been to a number of jails across counties in the U.S. and got to see what it looks like for the mentally ill to be in our justice system versus being in what we casually call a mental health system. So that was a very good eyeballing for me. And I also got to work very closely with law enforcement, National Sheriff's Association, International Association of Chiefs of Police, actually U.S. Marshals and some other groups. So I know how much they care as well. And I know that the tangible piece as we talk about 988 and some other things in terms of what it means to not just the individual family and individual, but also to our law enforcement professionals. So I think the background is really going to help. It's helped so far. I hope it continues to help.
I love it. Tell us about NAMI.
Oh my gosh, wonderful organization. It's an incredible organization of passionate people that give every day. It started in 1979 by 2 moms in Madison, Wisconsin, whose adult sons had been assessed, diagnosed with schizophrenia. And they were told that they were diagnosed with that, assessed with that, because of how they were being raised. And those 2 moms right there began what's really the linchpin of who NAMI is, which is advocacy. We didn't have any programs then, but it started with advocacy and it grew from there. First meeting was 254 people in 1980, and then it has grown into the organization it is. We've been around now 43 years, and we're the largest grassroots mental health organization in the United States. And we say grassroots because we're where the rubber hits the road. We're in the communities across the U.S. doing the work every day for individuals and families living with mental illness. It's important work. A large part of our organization is volunteer, if you will. And these are individuals with lived experience. And as far as NAMI, the other thing is that we walk the talk. What I mean by that is that 75% of our board must be representative of lived experience, because we want to make sure that we're very tangible in terms of what we're doing. So they either have to directly have lived experience with mental illness and or have a family member that has experience with mental illness. And what brought me to this work is losing my contemporary, who I should be spending this station of life with, who lost her life to suicide in 1986. And family, it's 2022. We still never talked about it. And I saw the ripple effect of what it did to my family. And if I could change that for any one family, and just change it for one family, I'd like to do it. And NAMI is a part of that work.
Wow. Thank you for sharing that. We talk so much about how when people have a real lived experience, that they can use that to really push them every day for someone else's legacy or to make other people not have to go through that. And, some people are able to be successful with it and other people it's harder, but that is really oftentimes what it takes, is that really personal experience that gets you up every day and motivates you. So thank you. Thanks for sharing it. Thanks for doing it. Cause you're right. We talk about this all the time, that it's still really hard to have these conversations. Mm-hmm. Even when you want to, it's hard to start them. It's just all across the board.
Yeah, the stigma is tremendous, and it is something that you have someone in your family that is a soccer athlete or a football athlete or any other kind of athlete, and they have a joint injury. They may have a cast, they may have a brace, and you go into work, to school, someone says, "What happened? How are you doing?" What we live with is invisible. And it's very stigmatizing in terms of having the opportunity to talk about it. And it is okay to not be okay. And it's no different than heart disease or diabetes or any of the other diseases of our bodies. It's above our shoulders, and we need to examine it differently than what we've been doing. And I do think that we're seeing a change in being open and discussing it. And it's a moment in time, and we got to take advantage of it.
So, Dan, so much of what NAMI does is help those families who are isolated and nowhere to turn. It helps them give them a path forward, and you literally try to help them navigate through lived experience of other family members who've had to go through this themselves. Like, what are the different paths that they can take on behalf of their loved one, and how do they go about doing it? So tell us a little bit about your helpline and the work that your volunteers do, helping the new families who've just had a loved one diagnosed with a serious mental illness.
Yeah, thank you, Patrick. And first of all, our helpline, you can get more information about our helpline, or you can reach our helpline by calling 1-800-950-6264, 1-800-950-6264. You can go to info@nami.org. Now, in terms of that work there with our helpline, it's a resource line. It is staffed by volunteers. During COVID, we increased the hours by 4 additional hours, and we've gone from a volunteer group of 60 to over a volunteer group of 100. We've got about 12 categories, and individuals will call in looking for information in regards to any one of the areas, from schizophrenia to early psychosis to bipolar to major depression. And they're actually looking for resources. Help me get to the resources that I need in terms of what's going on in my world. And this helpline has been a resource for about 20 years. It's an incredible resource, and we tell people you are not alone. And we have individuals that have those lived experiences. So when you talk about early psychosis, someone that is on the other end of that phone has that experience. If you're talking about schizophrenia, we have someone that has that experience. If you're talking about major depression, we have someone with that experience. If you're talking about veterans, we have a veteran that is on the phone. So we want to make sure that most times when we get those calls, we're the last resource, and they're feeling all alone. So we want to make sure they're not alone, and that we are absolutely connecting them with information and resources that they can use. So that's one part of it. The way we like to look at it, Patrick, is you have someone that's walking and they've got their phone and there's so much on their digital device, they don't see the manhole cover is open. They go down into the hole, and they're down in this hole and they can't get out. And then you have a person that passes by, and the person in the hole says, "Can you help me?" A doctor passes by, and he drops a prescription down in the hole and says, "Here you go." Then a priest passes by and says, "I will pray for you." The gentleman says, "Can you help me?" He says, "I'll pray for you." But then another man passes, and he stops, and he jumps down into the hole. And the man in the hole says, "Well, wait a minute. How are we going to get out now? You're down here with me." He says, "I've been here before, and I know how to navigate this, and we're going to do it together." Well, that's who NAMI is.
Oh my God, that just gave me the chills. What a great, I'm always so envious of people that can tell stories like that to get a point across. Well done. That was beautiful.
Thank you very much. That's who we are. And if I might, I'd like to share just a metric about the helpline.
Please.
Year over year from 20 to 2021, three areas of a dozen or so that we actually capture. We saw calls about depression and anxiety increase by 80%. So outreaches to our helpline increased by 80% from 2020 to 2021. Cool. Calls about suicide and suicidal ideation increased by 185%. And then calls about mental health crisis increased by 251%. And this is since the beginning of the pandemic and from 2020 to 2021. Think about those three metrics, the lowest one being 80%. We've got wonderful opportunities to make a difference, and more importantly than wonderful, a critical need.
Wow, that is really profound. What kinds of things are you noticing differently now? Like, have the calls, has the severity changed? Is there a themes, and is it different with COVID, post-COVID than pre-COVID?
Yes. Prior to COVID, the numbers were less. I think that one of the things that we like to speak to is these three things called fear, uncertainty, and doubt. There's a lot of fear that was created during COVID. We have, over 160,000 youngsters who lost a parent and or a caregiver. We have over 900,000 people that passed away during COVID. So between those young people that don't have that caregiver and the other folks that lost their lives, there's a lot of fear, uncertainty, and doubt that occurred during COVID. Also with our first responders and our emergency medical personnel working in the hospitals and working 24/7. Will I take COVID home to my family? Our young people with the on and off ramps of going back to school, not going to school. We are, a species that it's all about connectivity. What we saw was one of the huge areas of stress and anxiety came from mothers, came from women. And think about the duality and their roles. Many of them working moms trying to work from home and educate their child who is at home, and also make sure that they are taking care of their family. So we saw a lot of stress points with that.
And I would imagine that just like you said, the unknown, like that's the main thing that really kicks things in for people, right? Like, because you don't have much control when you are so not confident about what's going to happen. Yeah. And I think we don't realize how much control we like to have as humans, right?
Yes. And this is something we can't control. And, I think that we're now at a point where we know enough about the science that we should be able to do that. But what it's given us is a situation where with that isolation and what we saw in terms of the trends of young people going to the emergency rooms at a much higher rate because they could not access care, we're absolutely seeing the conversation about mental health, mental well-being, and mental illness as it has gone up 4x. All sectors of our community are more interested in the conversation, from industry and the private sector all the way to the public sector, in terms of you can't think of a community that's not talking about mental health and is not addressing it. Athletes, Naomi Osaka, Simone Biles, Michael Phelps. Look at the athletes that are now starting to speak up and be more profound and pronounced in speaking up. It's everywhere. It's pervasive. And the question is, what are we going to do about it? What are we going to do about parity? What are we going to do about the workforce? We have a lot to do.
I know. In a certain sense, it's also an exciting time, right? Because everyone's talking about it. Now there's like an opportunity to get some of these things done that so many of us, as like people like Patrick, just been, pounding and hounding on for so long.
And that's why I just admire Patrick so very much, and you, Marjorie, because you guys have been leaders. And Patrick has been a leader in this space where he's had to bring so many people along, but now he's seeing them with him. And it's so wonderful, but he's been the one that's had to be animated, has had to shout from the highest mountaintop from the standpoint of, you all need to understand this. And now it's like, okay, we've got some of the folks at the table now, and now he's challenging us to say, okay, what are we going to do? We got an opportunity. It's right here. Are we going to leverage this? And if we are, there's a window of time. And see, time's not our friend. Time is a new currency. We can talk about the fiscal year 2023 budget, which I'm very excited about, and all of the funding that has been put into that fiscal year 2023 budget for mental health. If you did a check and balance over the last, I don't know, say 10 to 20 year federal budgets, you tell me, I challenge you to find one that had nearly this kind of visibility about mental health and this kind of funding and this kind of comprehensive funding. But that's great. Now we got to get it passed. Now, where I'm going about Patrick and you, Marjorie, and all of us, for me, it's about leadership, tone, and execution. So we can have the leadership. We do need new tone. If we do what we've always done, we're going to get what we've always got. Yeah. So we need a different tone, and we need some aggressive, assertive kinds of behaviors. And we need some checks and balances from the leaders for execution once the money is there. And we got to fix parity. But anyway, I'm getting a little animated. You guys can't see me, but I have to learn from you all about being patient because the pain is real. The lack of access is real, and it's fixable. We are America. We can fix this if we have the tone and the desire.
Can you talk, Dan, about how we discard people in our society? You know the famous passage in the Bible about really the only way into heaven is to be there for those, at least one of us, my brothers and sisters. Just talk a little bit about the moral failure of our country in taking care of the most vulnerable amongst all of our citizens, people who have mental illness, people of color who also have mental illness, and those that then find themselves in jail. You've worked at the intersection of race, mental illness. Talk a little bit about those experiences.
Yeah, thank you, Patrick. We're an assumptive, just as people in society. We judge the book by its cover, and we don't have the patience, we don't have the desire to get behind the cover and read the table of contents. In terms of mental illness and race, if you think about both of those in the connotation of being discounted, being minimized, being invisible. Let's think about those three I just said: minimized, discounted, invisible. That happens in race, and it happens in mental illness. And NAMI recognizes that. So we don't want you to be invisible. We don't want you to be minimized, and we don't want you to be discounted. Also misjudged. No one chooses to have a mental illness. No one chooses that organ to work differently than other organs. But we seem to minimize and want to cast that person living with a mental illness outside of our family structure, outside of our society. And then if you look at our jails, it's shameful. They've become the new mental health hospitals across the United States. And the point in fact is that is judge and jury in terms of where they are continuing to be minimized, discounted, and misjudged. And if you look at race and mental illness, then you just do a 2 or 3x. And then you have the current situation in terms of what is occurring. And we need equity, and we need to really look at being inclusive in terms of our approach. And NAMI has 5 values, and our values are inclusion, empowerment, compassion, fairness, and hope. Oh. So compassion, fairness, and hope. You know, we need to bring hope to the hopeless. And that is in what Patrick just asked about in terms of the intersection of race and mental illness. And there's so much more deeper inside of that in terms of the assumptions and the decisions that are made based off of the pigmentation of a person's skin or their mental condition versus their physical condition. You can have lung disease, you can have cancer, you can have diabetes, you can have a number of physical ailments. You're still included. But if you have a mental illness, you're excluded.
First, let me just tell you, Dan, how much of an impression you've made on me, and really awakening my conscience. You know, we all think we know, but the reality is if we don't have to walk in the shoes of people with a different color of skin and have to live in a country that still treats us as second-class citizens, I really don't know. But because of people like you have sensitized me a lot more than I even thought I knew. I think I am trying to be a more conscientious American living in this great country of ours, but understanding that it still has so far to go in terms of treating all of its people with the same dignity and respect and rights under the law. No one could have lived through this pandemic and seen the racial pandemic underneath it and not been moved by this reckoning with race that our country has always had to grapple with. But we're in a moment of time where it's omnipresent with the just countless number of Emmett Tills who have died in just the last couple of years. I read about Emmett Till in the history books. I never thought I'd be living it as a young man in my 20s, 30s, 40s. Now in my 50s, I'm still seeing it. I'm seeing it all the time. And one thing COVID did was it stopped time so people could actually finally start paying attention to those statistics and understand that there were real people behind those statistics. So you've always lifted those stories up, and thank you for that, because lifting up real people's lives and the stories of these tragedies is so much more powerful than having them get lost in the numbers, which tragically overwhelm people and it's hard for people to relate to.
Yeah, thank you, Patrick. And it will take all of us, and it will take all of us advocating for all of us. So appreciate you more than you could ever know.
Talk about helping us understand vicarious trauma and how damaging it is to see these images of George Floyd play out over and over, and Trayvon Martin, Arbery, all of these tragedies, and the impact it has on our communities of color in this country, because these images are ubiquitous everywhere you turn.
You know, Patrick, you're going to make me get a real lump in my throat. This trauma is real. I have a son. I have nephews. I have a daughter. This trauma, starting with Trayvon Martin, my wife and I took all our son's hooded sweatshirts from him. We actually went in his closet and we took his hooded sweatshirts from him. Why should we have to take our son's hooded sweatshirts from him? There was a young man that was mistaken for breaking into cars on the West Coast. He ran into his grandmother's backyard and he was holding up his phone, and the officer thought it was a gun and shot him in his grandmother's backyard. We've had to talk to our son about him raising his hands in certain ways in terms of, if you are in a situation, no sudden moves. We're no different than any other family that has had to actually sit our son in the car and say, if you are stopped by the police, here's what you do.
Oh, wow.
Not what you don't do, but here's what you do. When you talk about George Floyd, when you talk about Trayvon Martin, when you talk about some of the other situations, it hits close to home. My son had major surgery on his ankle and some screws and put it and all this kind of stuff. So I was transporting back and forth to school. I got stopped by an officer saying the tint on the windows was too dark. A month later, I was bringing my son home from school. I got stopped again, and the windows were down. The windows had been down. It was a spring day. And I asked the officer, why did you stop me? And he indicated that the tint was on the windows. And I said the windows were down, and my son was in the back. So I said, well, I'd like to speak to you about this. I used to donate on behalf of the private sector group I worked with. I donated $10,000 every year to the Law Enforcement Memorial, and John Walsh is a good friend of mine. So I know law enforcement intimately and in many ways, but this gentleman was very interesting. And I guess where I'm going with the trauma is my son was in the back. My son said, Dad, please stop. Don't say anything. The trauma that he was already dealing with. So what's to happen for him if, in fact, he's stopped? These are things that we navigate that build into our lives. And my wife and I think about it all the time. So it's the reality that we're dealing with, and we're challenged with it. And it does go into the anxiety and the depression that many of our young people, as well as the parents, can try and navigate.
I think anybody listening can immediately think to myself, I don't have to worry about my children going into a grocery store and getting, someone thinking that they're stealing something and having them take them aside and say, show me, your money. Do you have money to pay for this? I have no experience with my family having to go into a store and people wondering whether they're going to steal something because of black profiling. I don't have that worry going in my neighborhood, driving around my neighborhood, wondering whether I'm going to get stopped because of the color of my skin. Dan, have no idea no idea what it's like. My heart just aches because if it were my kid who had to go through that, I can't know whether I could keep it together.
Yeah, thank you, Patrick. I mean, I just appreciate you, and I appreciate your understanding and your empathy, and it is real. And I mean, the fact is that we did sit down in the car, and we've not done it once. We've done it multiple times because, we have to have these young people remember. You won't find a hooded sweatshirt in his closet. And there's some other things as far as the experiences that we've had to adjust immediately, and in terms of how you carry yourself and what you choose to do and don't do, and to just be careful. So it is a unique situation. I'd offer that it's a unique situation, and it is an exhausting situation, and it's a fearful situation.
Do you feel like things are getting any better as we're sharing stories, and people like you are speaking out, and you have a platform, and it's so hard. I agree with Patrick to not everybody could relate. I mean, can't relate, but we can relate to the fact that we can't relate. Is there hope?
There's always hope. It's going to take leaders. It's going to take tone. It's going to take execution. It's going to take empathy. It's going to take understanding. And it's going to be walking in the other one's shoes. We've become a microwave society with crock-pot behaviors, is the best way for me to put it. And that microwave society is we're judge and jury quick. And then we take sides, and then it's judgment. And until we can actually kind of build that human experience in and walk in the other's shoes and think about, as Patrick said, his son walking into a store, his experience. It goes for all of us. So I do think that it is getting better, but I do think that there's some incredible challenges, because where Patrick and I work in the collective, and we believe in building coalitions, it's kind of like, do you want disappointment or do you want divisiveness? And right now, I guess where I'm going is that there's still a real sense of divisiveness. There's divisiveness from healthcare to mental health care. And there's divisiveness in terms of how we treat people from relations. So there's still this divisiveness. And until we can work collaboratively and think about building coalitions more intentionally, we won't be able to really fix it. It's almost like stigma. It is something that we just have to do it a bit at a time, and just to be very conscious about what we're doing.
Well, Dan, I am so honored to, be fighting alongside you. These are all the same struggles for social justice as my family has been all about. It's about widening the circle of opportunity each generation. And of course, we've seen, that circle gets smaller sometimes, but we got to keep pushing and making it wider and wider so more people can live in the same place where they have and are afforded the same rights, responsibilities, and promises that are kept. And we still have a long ways to go, but we're in it together. I love you. You're such a friend, and I'm really grateful to you for all you've done for NAMI, but also for what a personal friend you've been to me over all these years.
Well, I'm here, and if there's a wall and you say knock it down, I'll do it. If there's a hill you tell me to climb, I'm going to climb it. So I just want to make sure you know that. And, that's something that's probably been a part of my mantra, and it's NAMI's mantra, and I know it's yours, is people don't care how much you know until they know how much you care. So, you lead with caring, and I love you for it. And I just appreciate the opportunity to be considered a friend of yours and to work with you. So thank you for this opportunity to talk with you and talk with Marjorie. So thank you.
And I'm just honored to be here in the bromance between the two of you, and and to be able to just, shed a little bit of light here. Lots of nuggets came out of this. I especially still holding on to time is the new currency. But thank you. You are a remarkable person. Keep doing the work, and please lean on us in any way that we can help you at Psychiatric or anything if you need it. What you're doing is so important, and we're all here to support you.
As always, thank you for listening to our podcast.
If you enjoyed the show, drop us a review.
If you haven't already, subscribe to our podcast for the latest episodes.
For the latest insights, check us out at psychhub.com.